Good evening. My name is Dr. Cal, and I'm the CEO of Virtual Nurse. I want to thank you so much for giving me the opportunity to speak in front of you. Before I give any presentation, I would like to gauge my audience. So I'm going to ask you 3 questions. Based on that, I'm going to tailor my presentation. Question number 1. How many of you have done a Google search to find more about your health issues? Can I get a raise of hands, please? Fantastic. Speak to the right crowd. Second question. Now, when you get the Google search results, how many of you got overwhelmed? How many of you thought you had cancer or would die in the next 6 months? All right? Fantastic. It's overwhelming, right? Third question. How many of you would like to have an option where you click a button and you're connected to a registered nurse via a two-way video conferencing system? Can I get a raise of hands, please? All right, fantastic. We've heard your concerns, and we are presenting you Virtual Nurse. Just ignore that name on the top. It's we're going through a rebranding process. So what is Virtual Nurse? This is our platform. You get onto the platform and choose the type of nurse you want to talk about. If you want to talk about diabetes, you click that. Then you choose state. All right, click that. And click on Find Nurse. Well, here you'll get an option of all the nurses who are available on the right-hand side, and on the left-hand side. On the right-hand side, you have options to filter what kind of specialty nurse you want to talk to. Once you filter them out, go down, you also have the option to choose what price you're willing to pay. Go up, please. And the button I was talking to you about, it's going to be right here. So once you click that nurse, you're taken to a secure, HIPAA-compliant video conferencing system where you will have a virtual video consultation with a healthcare provider. That is a registered nurse. I want to show you a video of my team member.
Virtual Nurse is a service we are currently offering for a 3-day free trial. It's a wonderful platform that allows for nurses to connect virtually with their caretakers. In my work at the hospital, I've noticed that with a growing number of caretakers, there's really a growing need for caregivers to be available 24/7. And that's precisely what we do. We offer coaching, medication adherence advice, day-to-day consultations. We're not offering automated nurses. We're offering connections with real nurses, providing real care in real time. We are a virtual nurse.
Thank you. So that is Matt, our team member. I want to introduce you to my team. This is Javi, in charge of business development, Jonathan, Matt, Mohan, Ricky, and Ali. I want to thank you so much for giving us this opportunity, and we are eager to answer your questions. Yes, sir.
How are you dealing with the liability?
All right, that's a great question. 2 questions come up with any healthcare services or products is liability and who pays for it. Liability, we do have $2 million liability covered for errors and omissions. If a nurse tells you to jump off a bridge, and she was not supposed to say that, but if she did, we record each and every session, and if it turns out that the nurse gave wrong advice, we are covered till $2 million. Thank you. Yes, sir. Right. Right.
So that seems to be a more prevalent way. If that's part of your business.
Absolutely. We want to start with the consumer-driven, but we want to start with individual, but ultimately insurance companies are our target market. We want insurance companies to work with us because we are trying to do the exact same thing as how do we educate, how do we coach, how do we empower the patient so that the patient can do an excellent job doing disease management so that they stay away from the hospitals and so that the insurance companies can decrease readmissions. Thank you. Anyone else? Yes, sir.
How do you vet your nurses?
How do we vet our nurses? Sure, thank you. We do check their licenses, state by state. A nurse who is licensed in Massachusetts cannot work in New Hampshire. That's exactly why we are asking what state the patient is looking for a nurse. And we also interview them and we look at their background history and all that. Did I answer your question? You look puzzled. All right, thank you. Yes, miss. Go ahead. Sorry, I can't hear you. Can you please use the mic? Thank you.
Most insurance company offer, hotline that have nurses that, available 24/7 to answer all, occasional
Right.
questions. How's your service different from their service?
Absolutely. We're not trying to reinvent the wheel. What we're trying to do is replace that phone with a video conferencing system. When you talk to a person using video conferencing system, it's more personal. You don't know who's on the other line, on the other side of the phone because all you hear is their voice, so it's kind of impersonal. So we're taking that to the next level. That's exactly what we're doing. All right, last question.
With some of those services, though, if it's assigned with the insurance company, usually they can access some of your records. Maybe you can see some of your previous visits or what medications you're on. So you plan on being that connected?
Absolutely. Our system is robust, HIPAA compliant, and we can pull in medical records from different sources. So we can access any medical record into our system. So our system is just like Google Hangout, where you see at the bottom, everyone, their family, the patient, doctor, nurse, and the caregivers can be on the video, 4 video streams at the same time. And everyone can look at the electronic medical records, the lab tests, as well as medication history. So everything is robust, everyone can see everything. One last question. Who's that lucky person? Yes, sir. Yeah. So, for example, if you're dealing with partners.
Can you repeat the question?
This gentleman right here wants to know how we are pulling the lab tests into our record, into our system. I'll let the technology officer answer that.
Thank you very much. What we have is a HIPAA compliant platform, and in that, behind the scenes, we have not quite but almost similar to EMR functionality. So we don't market it as a EMR, but all the functionalities related to EMR facilities are in there. So when you've got a lab report, for example, you can upload the lab report to your file into the system, and so long as we identify who it is for, and in the system, when the video on the top, you'll see the video, on the bottom, you'll see all the relevant lab reports, right? Because it's just basically files that are being displayed to the doctor. Doctor can see it, the patient can see it, and they can discuss it together. Okay?
I assume
there's a doctor involved, and there's a lab test to be taken, and do you have any arrangements with that's a business relationship, that's going to be looking, how do you set up, who determines who's going to do the lab test, what kind of lab test, how do you get the results in terms of the business issues?
Robert, why don't we take this offline? I'm sorry, we're running late. What we're looking for right now is that we're looking for strategic partners who can do a research project for us. We are looking for a professor or a principal investigator who can run a research project on virtual nurse. What we want to do is that we want to collect data to show the insurance company saying that in fact virtual nurse improves patient outcomes. And we're looking for a principal investigator who can do the research for us. And the next thing what we're looking for is strategic alliances with any company in the healthcare space who want to partner up with us. And last but not the least is we are growing very fast and we're looking for team members. Come talk to us. Come talk to any of my team members right here, and we'll be able to answer any of your questions. I want to thank you so much, and you all have a good night.
Thank you very much.
Join Boston New Technology Meetup. Sponsor an event or a venue. Present your idea and attend to network with Boston's brightest. Details are at www.bostonnewtech.org and in the video description.